had an outbreak of a flu in Elementaita ward, specifically in Kiptangwanyi Health Center. Basically what happened is that the in charge of the facility reported an upsurge in the number of children, especially those below 1 year, presenting with high fever, cough, and difficulty in breathing, whose number was more than what was expected for that time of the year. That alert was sent to our Public Health Emergency Operations Center here in Nakuru, and a team of experts, including surveillance officers, was dispatched to Elementaita, and they were able to confirm that indeed there was a surge in the number of children presenting with fever, cough, difficulty in breathing, most of them below 1 year, and samples were collected for laboratory testing. These samples were taken to the Cambry CDC lab and also the National Public Health Laboratory, and the findings confirmed that 5 of the 9 initial samples had what we call the swine flu H1N1 variant of influenza virus. Thereafter, we were able to put in place measures to contain the outbreak. The good thing is that it was localized within one ward, and we were quickly able to put in measures and public health interventions to ensure that the spread is curbed. And I'm happy to report that as we speak now, the outbreak has been contained. We only have 8 admissions currently, 6 of them in the Kiptangwanyi Health Center and 2 in our main hospital who are stable. Basically, the symptoms of swine flu are just like any other common cold. In fact, it's a variant of the influenza virus, only that at discovery, first documented in 1919, and it was associated with pigs. It's one of what we call zoonotic infections that can infect both animals and human beings. But as the moment as we report, there is no outbreak in animals as it were. However, we've been able to engage all the other agencies, including the Department of Livestock and the Kenya Wildlife Services, to join into the investigation of this outbreak. Yeah, we run a very robust disease surveillance system. We have a Public Health Emergency Operations Center in this town, where we have a team that is constantly on the watch, on the lookout for any unusual happenings in health, and that is how we were able to pick up these. We call them signals. Whenever there is something unusual, it's reported from our facilities or from the community. We are able to pick them up so that we investigate further, and that's how we are able to catch up these outbreaks very early on. This is the second outbreak in the recent times. The latest one was in 2020, just before the COVID outbreak. In fact, it was in February of 2020. The symptoms are mild. Actually, most of our patients from the analysis are below 1 year. And below 1 year, you'd expect that the immunity is not very strong. And as such, and the management is just supportive management in terms of ensuring that they are able to be fed, they are kept warm, and they are given antibiotics to prevent any other concurrent infection. Otherwise, as I said before, this is a common cold. It's actually a flu, and it's self-limiting. For adults, healthy adults, it's not actually a problem, but it affects those in the extremes of age, that is very, very young and very old, whose immunity may not be as competent. The outbreak is contained. There is no cause for alarm, and as I have said, it's affecting a small group of the very young, and we've been able to put in public health measures to mitigate and to curtail this outbreak. However, I urge the public to maintain good sanitation, good nutrition, and good ventilation. Whenever you're in a room, ensure that is well aerated so that we prevent this. It's a droplet infection, and therefore it needs proper ventilation and good hygiene practices.